just thinking back on growing up in my childhood, I can remember reading articles about like runaway children and just different things that just drew me to that nonprofit work, and I really felt like that was what I wanted to do with my life. When I was 21, I became a big sister in Big Brothers Big Sisters, and my little sister, her son has grown and joined the Army, but when he was growing up, I mentored him as well. So it's just been, it's just kind of it makes my life very full to do this kind of work. And I think once you hear about CHIP and the mission of CHIP, you're going to understand why I've been there for 20 years too, because it's an awesome organization. I think it's so important I put a quote down here: do not ask yourself what the world needs, ask yourself what makes you come alive, and go do that, because what the world needs is people who have come alive. So that's really, I think about that frequently. My job makes me come alive. What I do makes me come alive. And I look at friends that do things that they earn a paycheck. But I think it's really important to do something with your life that has meaning and just lifts you up as a person and makes you feel valued. So I have, I told you I've been at CHIP for 20 years. My degree is in business, and then I went on to UCLA, did some healthcare executive work. I have been so privileged in my tenure at CHIP. I've met a lot of wonderful people, and through some partners at Virginia Tech, I was able to go to Malawi and to Zambia in Africa. They got a grant to bring some folks over from Malawi and from Zambia to they have NGOs there rather than nonprofits. They're non-governmental organizations. And they sent them through some public health classes, they developed a project, they got a little bit of funding, and then they sent them back to Malawi to do their project. And then we went over and looked at their project, measured their outcomes, gave them advice on how they were doing. And then I got to repeat that experience in Zambia. So I just had so many wonderful experiences, and I think, just making this your life's work, you meet all kinds of great people along the way. One of my goals for CHIP, and we'll hear more about this later, is to move CHIP towards having an evidence base. You hear a lot nowadays about programs, evidence-based programs, and that's a lot of where the funding is going. So we have really launched a pretty direct research initiative, looking at our outcomes, because really the bottom line, it's not just about the funding. The bottom line is making sure that what we're doing is working. It's working well for families and children and producing the outcomes that we want. We've partnered with Roanoke City Public Schools, looking at outcome data for our children and making sure that they're having school success, and doing more and more initiatives to really shine the light on our work and establish best practices. And my dream is to someday replicate what we're doing across the nation. I started out this by saying vision is the art of seeing what is invisible to others. I think any good leader has to have vision, and I'll go to the next one too, which is leadership is the capacity to translate vision into reality. I've had lots of peers and colleagues along the way who get very stuck in the details and the concrete implementation plan. But I think the very first step is to see the potential, the possibility in everything, and to be able to figure out a macro plan for that. You can have other people that can do the micro details, but a good leader really has to have that vision. And when a problem is brought, just immediately think, collaborations or possibilities or, just creative ways to solve those problems. So I'm going to move into telling you a little bit about CHIP. I got a little ahead of myself with the evidence-based piece, and I'm going to slow down after this CHIP presentation and just give you all a few minutes to ask me questions and finish processing what I've just presented. So CHIP has been around since 1988. We were started locally with a local pediatrician, Dr. Douglas Pierce, who is now retired, but he is still on the CHIP board, a lifetime member of the board. We serve children from birth to kindergarten entry and also pregnant moms. To be eligible for CHIP services, you have to be at or below 185% of poverty. Most all of our children have Medicaid, which puts them at pretty much extreme poverty. It's 133% of poverty or below. And we are a home visiting program. So what that means is that we have nurses and family case managers, and now we have licensed clinical social workers and counselors who can go into the home and provide home visits. It's really a coaching, a family support type home visit. And I'll tell you a little bit more in a minute about what we do when we get into the home, but it's about building that relationship, and those relationships are what help people see their strengths, move them in a positive direction. And really, for some families, they're our only support system, so they rely very heavily on our support and coaching. To be eligible for CHIP, you have to be below the age of 4 because we discharge children at kindergarten entry. So it's important that we have a few years to work with them before they enter kindergarten, particularly as we look at, the quality of the program and really trying to have an impact on kids by the time they reach kindergarten. The localities that we serve are the 5 localities minus, it's the 5th district minus Allegheny, so Roanoke City, Roanoke County, Botetourt, Craig County, and the city of Salem. So I mentioned a little bit about the nurses who go into the home, and that they really provide the healthcare coordination aspect of what CHIP does. So they're very focused on that child having a medical home. For many children, they come to us having used the emergency room. A lot of the culture of poverty is around not really understanding how to use a medical home. So that's part of what we try to help coach families to do. The nurses are all certified in asthma case management. They're certified asthma educators. We have about 185 children who we are asthma case managing. Asthma is so prevalent in this region. I think we are in a little bit of a bowl and lots of allergies, and also a lot of research shows families in poverty, many of those families have children with asthma, primarily because if you're in low-income housing, oftentimes there are issues with cockroaches and other pests. Sometimes parents smoke, so that's part of what we do is try to coach them to smoke. If they're going to smoke, smoke outside the home, put on a smoking jacket, take it off when you come inside, but ultimately quit. And what we have found is with a lot of the low-income housing, we are seeing mold, which really exacerbates the children's asthma. So we're working with Roanoke Redevelopment and Housing Authority and some other folks to try to do some exacerbation around those mold issues. We also enroll children who are discharged from the NICU. So many of those children have respiratory issues, underdeveloped lungs, or have other medical problems. And then we get a lot of referrals of children with chronic health conditions. If you all Facebook, which I'm sure you do, or tweet, you should check CHIP out on Facebook. It's www.chiprv.org. We're featuring Spencer this week, who is a special needs boy that we are case managing. But we've got a little video on YouTube that really tells Spencer's story and kind of walks you through what CHIP has done for him. Part of what the nurses also do is oral health education. So they apply fluoride varnish on the children's teeth as the tooth buds erupt from the gum. Again, children in poverty oftentimes have a lot of oral health issues, dental caries. It's the second leading cause of school absenteeism among children, so we're trying to teach those good oral health practices early. We also have something called Chip Fit, which is, when you're in the home, it's just mind-boggling. You've got all these great opportunities to teach, and we can, we're always trying to find that teachable moment with many things, and it's oftentimes hard to buy fresh produce and eat healthy when you're on such a limited budget. So we try to give ideas for healthy foods, healthy recipes, getting your child outside to exercise, just really talking about activities you can do with your child, even if you're afraid to let them play in the neighborhood, things that you can do to get them away from the TV and away from the screens and moving a little bit. And just last October, I'm just so excited about this aspect of what we're doing now. The board decided that we really, we have so many families with intergenerational trauma, and what that means is that parents who have suffered from abuse or trauma in their childhood, and oftentimes repeat that cycle with their children. Sometimes because of their needs, they get into relationships that are not healthy for their children, and then their children end up being abused as well. So we have started offering play therapies for our children who have suffered trauma or abuse, and simultaneously we can do counseling for the parent. And keep in mind that many of these parents are uninsured, so they have never had access to any kind of counseling services before. Medicaid only goes up to 18 unless you're pregnant, or unless you're on TANF, which is Temporary Assistance to Needy Families. I think it's now called SNAP. Or you're on disability, and that's Medicare. So that is the nurse side. And then the family case manager side is what we call family strengthening. But really, they work in teams. So nurses and case managers share an office, and you're going to hear more about this team environment as we go through kind of the organizational structure and the organizational culture. But they share families. So there's always a nurse available to every child, and there's always a family case manager available to every child. The family case manager obviously doesn't have the medical background, so if she runs into an issue that's more of a medical issue, she can bring the nurse with her. But she still does all the developmental stuff, so we do ages and stages, developmental assessments on the children every 6 months, making sure that they're hitting their developmental milestones. For many parents who have a 10th grade education or less, they are often unsure what to do with their baby, so we have a lot of resources available, Great Beginnings, Parenting First Year, Parents as Teachers. We've got all kinds of curricula that we can help them understand how many diapers their baby should be going through, how to potty train, just anything they want to know about parenting. And that's part of what we do is really help empower them to take care of their child. I've always said that no parent starts out wanting to be a bad parent. They just lack the knowledge. They lack resources, and it's our job to help empower them to do the best job they can by their child. And part of what we're doing is setting goals for the families. We're strengths-based, so we look at, even if it looks like the family is falling apart, we look at what strengths that family does have, focus on building on those, and coming up with a family service plan so that they can start to dream too about where they can go and what can happen in their family. And then around age 4, we do a kindergarten readiness curricula with the children to try to prepare them, make sure that they're ready to start kindergarten and can do their rhyming and their shapes and their letters and recognize titles and authors on books and all that kind of stuff, which is the phonological awareness, which is what children have to know in the inner kindergarten. And then I've already mentioned the mental health counseling a little bit. We purchased a building to do that. And one of the beautiful things about this counseling component is our counselors can go in the home and meet the family first, kind of develop a little bit of a relationship there, and then we can transport them out of the chaos of their home to the counseling service at the office. We have child care, volunteer child care providers, and we provide transportation. So we make it very accessible for the families.
It's not just a room either. You guys really upfit that area for those children, right?
Yeah, we did.
It's highly specialized.
Yeah, it's beautiful. So before I go into the history of CHIP, I just want to kind of profile a family and what we do for a family so that you can better, these are words and it's a lot of just blah, 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 but I think what really brings it to life is to really understand what that looks like with a family. What do we do when we go in? So I'm going to tell you a little bit about Hope and her children. Hope is an individual who was diagnosed with breast cancer, had been through chemotherapy and surgery, and actually lost her job because she missed so much time from work for chemotherapy and the sickness that went along with that. She was living in a one-bedroom apartment. She had been very good friends with another gal in her childhood, and this woman developed a drug addiction, and she lost her older son. This other woman, apparently her children, she was asleep due to drugs and kind of out of it, and her 2-year-old boy at the time was crawling out the window of their 2-story housing unit, and her 4-year-old daughter they were basically locked in the bedroom together. They had butter to eat, and they could eat out of the trash can. Child Protective Services was called in. They removed the children. Mom called Hope and said, I want my children to know you, they love you, you're their godmother, will you take them? She took them. She had never been a parent before. She is sick with cancer, just lost her job, has a 1-bedroom apartment, and has 2 children. So Child Protective Services referred her to CHIP. And so we started working with Hope and her children. We helped her, we started the process for her to gain custody of those children. The little boy, who was 2, had never been to a pediatrician, never had an immunization or a well baby visit. The little girl was suspected of being sexually abused. She had terrible oral caries, dental cavities, and had an attachment disorder. So basically what that means is because she was locked in a bedroom and didn't get much love, everybody that came to her, she would just run to them and hug them and attach onto them. So we had a lot to do with this family. We got the little boy into a medical home, hooked up with a pediatrician, started getting him caught up on his immunizations, his well baby visits. We simultaneously tried to help Hope find a bigger apartment so that she could have room for her children. Hope knew nothing about parenting, so we took her all kinds of resources, started doing developmental assessments on her children, gave her books, gave her toys, helped her understand what kinds of activities she could do to really help them develop. We coordinated a dental home for the little girl who had a lot of cavities and started helping her with the surgery that she needed. Obviously provided a lot of parent education and support. over time, the little boy got caught up on his immunizations and was able to go to Head Start, so we got him enrolled in Head Start. We got the little girl into play therapy with our new licensed counselor, and now Hope is also in counseling therapy. She's dealing with a lot of grief over her health issues, and just kind of shock of having these two children and, you know, what's going to happen to me in the future. She was recently diagnosed with the BRCA gene, so that means she's at risk for ovarian cancer as well. So we're trying to help her with a life plan, and just, you know, these children are now very, very attached to her, and she's a great mom, and she's doing a wonderful job. But really, Chip has been a lifeline for her. And that, I think, of all stories, that story of Hope just really brings to light just kind of every segment of what we do. We've helped her with, you know, nutritional advice, with developmental advice, with parenting advice, oral health, the pediatrician, and now the counseling piece. So she's on her way, and those kids are doing great. The little girl is now in school. She's doing well in school, and that's another thing that our counselors did. They worked on a 504 plan at the school, and they're doing strengths and difficulties kinds of assessments with the teacher, as well as with the counselor and the mom, just to make sure that everybody's seeing the same thing and is on the same page. So I think they have a very good chance at success. So I'm not going to go into the history yet. I'm going to stop and let you ask questions. Is there any questions that you have? If I run through anything too fast?
So I understand that you help children between the ages of birth and 6 years old. Do you do anything to connect them with other resources once they age out of the program?
Yeah. Obviously, our hope is that by the time they get to school, they've learned how to use a medical home. They're hooked up with a pediatrician. They're not using the emergency room. They've got a dentist. They're developmentally on target. But we also give the parents an opportunity to have a big brother or big sister for their child when they turn 6. We've got a formal partnership with them. And we give all the parents at discharge, kindergarten discharge, a packet with information on homework help, after-school tutoring, all that kind of information, because many of our parents have very low education levels, and they're not going to be able to help the children with their homework. So we feel like that's a really important thing. And that kind of leads me to that school study that I mentioned when I got way ahead of myself. But that's one of the things that we're looking at is how our children are succeeding once they get to kindergarten. And we're looking at it by risk factors, so we can break it down by things like the parent education level, the length of enrollment in CHIP, if the parent had a mental health or substance abuse disorder. And then we can kind of shift our thinking and put additional supports behind those families that we know are more at risk. So it's a beautiful thing, because in terms of the quality of the product that we're going to be able to give to the families and the children, it's really telling us a lot. It's going to be great. But that's something we're always working on, is more and more partnerships and collaborations.
You talked about your big goal to become national, but what would your next, smaller goal be? You just mentioned that you got the second building to be a counselor. What would the next one be?
It's further on in my presentation, but I'll just tell you now, and we'll skip over it when we get there. So we're in the process of a 5-year strategic planning process right now, which is something also that leaders need to do of organizations, is to really think about strategic planning, and then not park the plan on the shelf, but look at it all the time. Make sure that you're doing what you say you're going to do, and if you're not, what in the environment has shifted that makes your organization need to shift. So we're really assessing our environment. We're doing some stakeholder focus groups. We've met with the staff and a lot of the different board committees, and we're kind of organically hearing what they think the next step should be for CHIP. We feel like we have expanded program just about all we can asked the staff to do at this point. And part of what we really need to look at is our technology. It's so expensive to continue to replace computers all the time, and we use laptops in the field so that we can collect the data. But just doing a major technology upgrade. Infrastructure is the other thing. As an organization grows, and we'll see the organizational chart a little bit, but now with this new research component, that's going to take me away more presenting at conferences, doing poster presentations, other meetings with research institutes, and so who's going to man the ship, while I'm gone. So looking at issues like that, and what kinds of infrastructures do we need in place to support the staff, to support the organization's growth, because it's a lot of organizations, unfortunately, kind of expand, and then they start to fail, and they say, oh my gosh, we didn't plan very well for this, we need more human resource structure in place. So we're trying to get there before we go into any more expansion. So I'm going to move on to the history. Your clock is really off, isn't it?
Would it be an hour off?
Is it exactly?
It's a full
an
hour. Is it exactly an hour?
It's basically
Should
1
be.
hour off.
Okay,
Uh-huh.
good. Well, that'll help me then. So our history, I'm going to not go through belabor this, but we had been around for 20 years. We started out public-private partnership. We started out with all health department nurses. They were employed through the Department of Health. All of our family case managers, they were employed the second year, and they were employed through TAP. And then we incorporated as a 501c3, which is a nonprofit corporation, and spun off. And so this is the part of the history that really didn't happen very well. But we got this great funding from Kellogg Foundation, which was amazing. We got $1.2 million. But what that did, and I wasn't there at the time, but it kept the board and the staff from really thinking about what are we going to do when this grant runs out, and we have to actually raise money to support this organization that we're growing by leaps and bounds. And it also, we got lots of national attention, Children's Defense Fund, George Washington, lots of folks came down and saw what we were doing. It was an innovative program. They wanted it replicated. So then they got another grant from Kellogg Foundation to replicate it 2 years after we started. We hadn't even established best practices yet. So unfortunately, that's where the history gets a little mucky. And we did replicate, which is still a good thing for children across the state of Virginia, because they are getting services in the vein of what we started out to be. But it unfortunately is not the same across the state. I think because we started here and we had so much community buy-in from pediatricians and local governments, it has just, here we're much more medically focused. It's still the same family support services across the state, which is the crux of the program. But the kids in this area get more medical attention. We do record sharing with EPIC, with Carillion, and with Lewis Gale, and with Physicians to Children. So we know before we go on a home visit if that child's been in the emergency room, or if what medications they're on, and that sort of thing. It's a lot more holistic in terms of the care. So as we move through the years, we so in 2001, we used to be over in a building on Luck Avenue, and our board started talking about, gosh, it would be so great to move into a nicer space. There were no windows in that building. It was like a rabbit warren that just went really deep. And so Doug Pierce went to Tom Robertson at Carillion at that time and said, why don't you consider donating a lease? We're going to move out of this Physicians to Children building, so why don't you consider donating that lease to CHIP? So they donated a 25-year lease to us. Again, for a nonprofit, that's awesome because now we didn't have to pay any rent at that point. And more of the money that we raised could go directly into services for children and families. And then just last year, Nancy Agee, who is the head of Brilliant, turned the deed over to CHIP, so now we own the building. So that's a great asset that hopefully we'll never get into terrible financial trouble, but at least we have that asset on the books. In 2004, we became licensed through the Department of Mental Health to provide mental health case management services. We just stopped doing that about 2 years ago and morphed more into the mental health counseling. And then you can just see kind of the chronological order of how we started each program. 2006, 2007, we really started implementing more programs. And 2011, we really jumped off the boat and decided we'd buy laptops for all the staff, and about 30% of them got really excited, and the rest of them were like, oh my gosh, don't make me use this thing with my families. But so we started, we're very flexible in how staff use those. They have it so that if they pull into the 7-Eleven after their home visit, they can enter the information, or they can do it. Some of them are very comfortable having a conversation and still in it. But those laptops have been so helpful in terms of all the data that we collect and the research that we'll be doing. In 2013, lots of you have probably heard of J.J. Reddick, who is our town's famous basketball player, and he is an NBA player now, and he's from Roanoke, so he picked CHIP and Children's Miracle Network to do a big golf tournament for, and raised about $77,000 for us. But then got traded, and he's out in LA, and his family has moved, and he's not going to do that fundraiser anymore. But just in terms of thinking about ebbs and flows of running a nonprofit, you think about having a fundraiser that raised $77,000 one year, and then the next year that funding's gone. That's kind of the cycle that I live, because we get grants every year, and you're never sure which ones you're going to get, what's going to come, what's not going to come. We have a fundraising goal of $610,000 from this community, so it's a lot of money to raise every year, and that's what supports staff salaries. 83% of our money goes into staff salaries because we're a service organization.
That $300,000, do you have a grant writer, or are you it?
We do have a grant writer, and actually that $300,000, we also have a part-time 16-hour-a-week major gifts officer, and so he has been cultivating that relationship, and they donated $300,000 over 5 years for us to buy